So fast, you want this fast. You've heard that behavioral techniques, cognitive maneuvers, or even something called hypnosis can help keep your hands off your face. This is the COVID-19 epidemic, and it's not funny. This is also not therapy. People touch their faces 20, 25 times an hour. It's normal human behavior. So this is no kind of treatment. This is no kind of therapy. But this is a good decision. This is something you need to do. The hand-to-face vector is 3 times more important than the inhalation one. We need to keep our hands down, away from our faces. I'm Dr. Ron Ireland. I'm a family doc from semi-rural Ontario, and I've been using hypnosis since 1984 as both treatment and therapy in my clinic. But let me stress again, this is not therapy or treatment. This is a self-help tool. This is a focusing exercise. This is a way to use your imagination and your curiosity to come up with a solution that's good for you, to keep those hands down. A hands down great solution for you. Once again, I should mention, as I always do, that hypnosis is a medical tool. This is well accepted. We've been using it for a long, long time. It's as old as acupuncture. I've got a textbook of hypnosis in my desk. It's very possible your family doctor has a textbook also in his desk. I use hypnosis all day, every day, because trance is an everyday human experience. And it starts first thing in the morning you wake up, and it continues all day until you go to bed. So a little bit later in this video, very shortly, we'll be going into using some hypnosis techniques for you. However, I'd like you to first get consent from your parents if you're under 18. Although this isn't treatment or therapy, this is something called hypnosis, and there are large religious groups that feel that hypnosis is some kind of an occult, mystical thing, which it isn't. So I don't want your parents mad at you. I don't want your parents mad at me, so I'd like you to go first, ask their consent if that's all right. So I'll just pause it here for a second so you can get that consent. So there's a number of behavioral techniques you can use that are fairly quick. You can put an elastic band around your wrist. I didn't bring one with me today, but you could wear an elastic band around your wrist, the same kind of one that holds asparagus together or other vegetables. And you can simply snap that elastic band when you think of touching your face. Now, I don't particularly like that technique. It hurts. It's sort of hitting your thumb with a hammer to forget you have a headache. I don't really think it's a great maneuver myself, but it might fit you, and if that's something you want to do, that might be one of the best ways you can think of to keep your hands down. So other things you can do, you can distract yourself, you can walk around with a deck of cards in your hand, you can walk around with a tennis ball, you can use one of those stress balls and squeeze it. If you're sitting down somewhere, you can be crocheting or using your hands otherwise, or even sitting on your hands. But to me, I think the hands down best way of doing this behavior change that you want to start is by doing something called hypnosis. So hypnosis is a series of tools that clinicians use to help induce deeper trance. So we don't need to go through a big long induction. We don't have to do a whole lot of deepening, because believe it or not, you're in deeper trance now watching this video than you were 3 minutes ago before the video started. We've proven that people that watch television are in a bit of a trance. And you can continue just to watch me. You can sit back comfortably somewhere and shut your eyes, doesn't matter. Anything is okay. You can just continue to watch this video, and I'm sure that'll be just fine. We all want things fast. You know, there's fast food. People used to drive up to the burger joint and they'd roller skate over with a tray of food and they'd put the tray of food beside you. It's not fast enough anymore. Now you want to drive through the drive-through and get our burger and our shake, and you want to be eating it before we leave the parking lot, which isn't safe. There's a 30-minute oil change. We drop in for our 30-minute oil change, and at 38 minutes, where we've got our nose pressed against the window and we're tapping our fingers on our watches saying, like, what's the problem? 38 minutes for an oil change. I've heard of drive-through weddings in Las Vegas. They all want things fast. I get it. One of the reasons for this video is the change in policy through the CDC and in Health Canada, where there's actually some recommendations now for wearing masks. And there's a lot of misperceptions about masks. So I'd like to start this little session with a bit of a story. We all learn from the stories. I mean, before we had papyrus or before we had hieroglyphics, we had stories. And human beings have always passed on knowledge through stories. I mean, you learn about Goldilocks and Three Bears, and you learn about possession and not taking what isn't yours. You hear about Hansel and Gretel, and you learn to trust your parents and not to trust strangers. So stories are a really good way of learning. And I remember once, I'll just start with my first story. I remember I was a first year medical student, I think it was in 1982, and I was in London, Ontario, and I was scrubbing for my first operation. So under the watchful eyes of a scrub nurse, I was washing my hands, and she was stressing to me that the only thing clean was the water inside the taps and the soap inside the dispenser. So there's a certain way of washing your hands. You had to get every surface of your hands. You had to get underneath your nails. You had to wash your wrists and all the way up your forearms. You had to have the water pour down your fingers down towards your elbows. You didn't want to go the other direction because you had to keep your fingers the cleanest. And I think she made me do that first scrub for 7 minutes. And then I touched something. Somehow I touched the tap and I had to do it again. And she made me do another 5 minutes. And she's smiling at the end. I don't know if she's laughing at me or she's just content that I'd washed my hands properly. But at the end of 12 minutes, she was satisfied. So I walked in the OR. I'd already put my hat on, my surgical mask, before I started scrubbing. And of course, there's the lengthy maneuver of putting on your surgical gown and putting on your gloves. And I was standing there assisting for first year medical students, basically holding a retractor and cutting some suture. But it's so incongruous to me. I had this, here I was staying in London, Ontario, named after London, England. And my professor there was a deep southerner. I think it was from New Orleans or somewhere in Louisiana. He had a deep, deep chuckle. And he had a deep drawl. So he was grilling me on anatomy, and I was screwing up. As the pictures in the anatomy textbooks don't look like real life. I mean, the anatomy textbooks, you got red arteries, you got blue veins, you got yellow nerves, and nothing's color-coded in that wound. Everything was red. So I was holding my retractor, and I was helping cut some sutures. And he was tying up his little bleeders. And there was one he couldn't actually tie off. He couldn't get a suture around it, and the patient was continuing to bleed. And of course, in surgery, there's no option to try to get the bleeding to stop. You had to stop the bleeding. So he pulled a trick out of his hat, and he used something he had never seen before. He'd used a little electric pen, a little white pen. It was attached to a wire, and he pushed a button. There was a little bit of electrical current, and he stopped that bleed. A little bit of a spark down there in the tissue, and there was some smoke. And I remember being startled because I had a surgical mask on, and frankly, it didn't smell too good. Of course, I tried to play it cool. I didn't say anything, but he looked up at me over his glasses. He sort of had that deep, low chuckle, and he said, "Son, the only thing that surgical mask is there for is to keep your nose from dripping in my surgical field." And he laughed, that low, deep chuckle. And I was startled again because he said that. And he said, "Look, son, the surgical mask is meant to keep things in, not keep things out." So, the CDC and Health Canada recommendations for wearing cloth masks are good and they're bad. And that's why it took so long to get these recommendations out, because there's real controversy. Wearing that surgical mask can give you the confidence to break that 6-foot social separation, which you need. Look, that surgical mask could be the most patriotic thing you could do. You could wear the stars and stripes if you're in New York City. You could wear the maple leaf right around your face. It could be the most patriotic thing you could do, because what you're doing is you're protecting your neighbor, not yourself. COVID-19, one of the nasty parts of this bug, is that you're infectious for 2 to 3 days before you get the syndrome. Before you think you're sick, you're infectious. So these cloth masks, and maybe you're making a cloth mask right now on your kitchen table with a t-shirt and a pair of scissors, and I'm not knocking that. If you're deciding to wear a mask, you got to do it properly. You've got to wash your hands before you put it on. You got to wash your hands after you take it off, and you can't touch your mask while you're wearing it. If you're deciding to wear a cloth mask, please Google how to wear a cloth mask properly, and then use them properly. The problem with wearing a cloth mask is it can break that 6-foot parameter. People get more confidence than they shouldn't, and people touch their face all the time with the mask. So if you use it as a tool to help you learn to keep your hands off, that's great, because the hand-to-face vector is 3 times more important than the inhalation one. Anyway, fast and slow, good and bad. I mean, the CDC recommendations are good and bad. I mean, I like drawing with pencils and paper. I mean, I love a beautiful artist pencil, and I love a beautiful piece of paper, and I love trees. So my beloved pencils and paper are good and they're bad. Keeping your feelings to yourself, often good. In a marriage, often bad. A lot of things are good and bad. So, another story. I was even younger. I was in, I think, about grade 5 or 6. And my a good part of my science grade that year was going to be based on going into a science fair. So we had to demonstrate some kind of science project, and it was wide open to us. We just had to go home and talk to our parents and figure out what we wanted to do. So I remember coming home and talking to my parents, and I knew that one of my buddies was making a volcano. So I talked to my parents, and my dad was a really smart man, and he said, look, why don't we just grow a seed? I'm like, grow a seed? I mean, my buddy's making a volcano, and I think it had sound effects and flames and smoke. I said, no, let's just look at how a seed grows. So we had a little jar, and he took a piece of ink blotter paper, which we used to use with fountain pens. It's a very absorbent piece of paper. I think it was yellow. And he cut a strip of this paper and he put it around the inside of the jar and held a little kidney bean against the jar with his blotter paper. Put a little bit of water in the bottom of that jar. And the water slowly crept up that blotter paper and moistened the seed. He said, look, all you got to do, we put it somewhere warm. I think we had an incandescent light bulb there to warm it up a little bit. So we just put it somewhere warm. And every day, my dad got me a little book, and I would do a little drawing of the seed. And then it started to sprout after it swelled a bit. And the root grew. And I remember asking him, I mean, should I put some measurements on my little data that I'm writing down? It wasn't good enough just the picture. I think I should write down some measurements. And he thought that was a great idea. And then he stopped me. You cannot pull the seed out of the jar. I was going to pull that seed out to measure the root. He said, no, if you do that, the seed will die. You can't put your fingers past the glass, he said. So I used my measuring tape, and I got better and better at measuring the root on the other side of the glass, and I wrote my measurements down, and I remember the stem started to sprout up. It was green. I remember my parents went to get me my first set of colored pencils, and I was so happy. I wanted to make it as accurate as I could. Then the science fair came, and I was right beside my buddy that had a volcano. So here I was standing with my little jar, and I had a plant that had some leaves on it by that point, and my little book with all my observations. And I was so embarrassed. There was another kid that had a Bunsen burner. I mean, how the heck you got a Bunsen burner in grade 6? Well, rules are a bit different back in the 60s. So they came by and looked at my little project. I was kind of surprised because they looked impressed. I mean, like, it was just a plant. Well, the volcano won first prize, but I got second. There's nothing in science can replace that careful observation. This careful observation. So you might find something in your drawer, in your kitchen drawer. Like I challenge you to thread a needle fast. I mean, you can't do that. If you take a thread and you jam it in your needle, you can't jam a thread in the needle quickly. You can't thread the eye of a needle that fast. In order to thread the eye of a needle quickly, you need to rummage around in your kitchen drawer where all the junk is and find a magnifying glass, and then you wet the thread, and then you very deliberately, with a good light source, thread the eye of that needle. So by taking your time and being patient and finding the right tool, you can get the job done hands down fast. So you might be able to find something in your memory that you find really speaks to you to help you do this task. You might be really intrigued. There's a couple of other hypnosis protocols from a couple of really amazing therapists down the States, Rick Goodling and Peter Gardner. One of them had the glass imagery that I've just used, and another one was talking about Star Trek, which I loved as a kid. So you could do that just as well. I mean, if that sort of strikes your fancy, you could leave the house and say, shields up. And if that little itch, that little pick in your face started to bug you a little bit more, you could call on Scotty to really charge up those dilithium crystals. You can do what you want. You might have another experience deep within your mind and your memory that you can pull up. You can use your imagination, your curiosity, come up with something that speaks to you. Because what speaks to me is my dad. So when I leave the house, I think of my dad and that science project. Do I feel a little something in my face, a little bit of a twitch, or a little bit of a tingle, a little bit of a dig? I just pretend it's a little seed, a little kidney bean. I just watch it. I just observe it as it changes. I just measure it. I mean, have you ever done that before? No, we all want fast food. We want the drive-through burger. So we pick it and destroy the flower that could blossom there. So I just observe it. And I just wonder what kind of blossom is going to appear next time. Sometimes when it really bites, it's a lobster claw. Lobster claws are fun. Look them up on the internet. It's a really neat tropical flower. Reds and yellows. Sometimes a beautiful ginger lily. Or an orchid or a plain old dandelion. It was funny. As you just observe that blossom in your face, the wind just blows the petals away. So, I had a patient once, very recently, concerned about going outside because her eyes would tear. You don't have to dab your eyes. Observe the tears. Observe the tears that roll down your cheek. And if your nose drips, look, we're all 6 feet away. Who's going to see that? Who's going to see it? Just sit back and observe. So sometimes it's all about waiting. And we walk around the streets and we see these empty streets, and some people are getting very frightened and think it's pre-apocalyptic. No, and this is like Christmas morning, guys. Like, sometimes we have to wait and use our patience to enjoy the celebration at the other end. This isn't going to last forever. I've heard people say, this will never change. No, this will change. We're going to get back to movie theaters again. We're going to be able to go to a baseball game again, enjoy a hot dog, and catch a bag of peanuts when they're thrown to us. Come on, we're going to enjoy that again. It's going to be a while. They're already doing drug trials. They had one of the fastest vaccines ever developed for this virus. It's in testing right now. Yeah, it's going to be many more months. Might be next spring, might be next summer, but we're going to have a vaccine. And we'll all be able to get back together again. Imagine the celebration we can have at that point. This is like Christmas morning, guys. It's not pre-apocalyptic, it's Christmas morning. So you can see yourself, a week from now, using these new skills, using these new tools, finding something in your kitchen drawer that really speaks to you, doing these techniques, getting better and better at it, building those muscles. Amazing. You can actually walk around outside now without touching your face. You can see yourself in the summer. We're in spring right now, the daffodils are up, but you can see yourself in the summer. You can see those big green leaves. You can almost hear them rustle against each other. Walking along the street, you can feel the sand underneath your feet. Months, and your skills are so sharp now, you don't have to worry about it. Your hands never touch your face. In the fall, those beautiful green leaves falling, turning red, crispy under your feet. Christmas time's going to come, and we're still going to be probably socially distancing. It's going to be tough. Christmas time's going to be hard. But you know what? I bet you the wave will be down. I bet your medical capacity will be up, and I bet you the meds we have will be much more clearly clarified. Maybe we can rejoin at Christmas time. Maybe we can. We'll have to listen to the advice at that point. But a year from now, and certainly next summer, you're going to hear an announcement of a vaccine available. And this will all end. Just like Christmas morning, we'll be able to open that beautiful present and celebrate with our loved ones. So, you can figure out something to do. We've got great confidence in you. Human beings have an amazing talent and capacity for imagination and curiosity, and that's all you got to use. So, enjoy yourself. You wear the mask if you want. Be careful with it. I'm going to put a little internet address in the description of this video so you can learn how to wash your hands properly. Please access that. Because nobody does. It doesn't take just 20 or 30 seconds of soap and water. You have to hit every surface. So underneath this video in that description, I'm going to have a little site you can go to learn how to wash your hands properly. Okay? All right.